Welcome everybody, and thanks so much for joining us today for our session on implementing the no-pass zone in your organization. I'm Kristin Baird, President and CEO of the Baird Group, and we are a consulting and medical mystery shopping firm dedicated to improving the patient experience. And prior to creating the Baird Group, I spent decades working in hospitals, and in my last leadership position, I implemented a no-pass zone. So I can speak to the importance of having a no-pass zone as part of a patient-centered culture. I can also tell you that I wish I had the tools we're going to introduce you to today. And speaking of tools, later on you're going to be hearing from Patrick Baker, the Chief Nursing Officer for the University of Cincinnati Hospital in Westchester. And Patrick has successfully implemented a no-pass zone and is going to share with you later on the steps he took and the tools he used to engage and empower all of his staff so that they could confidently participate in a no-pass zone in his organization. And also with me is Tim Jones, the CEO of HealthNets Media, the creator of the no-pass zone video and moderator tools that Patrick used to help implement and then sustain a successful no-pass zone. So without further ado, let's jump right into it. So what we're going to cover today, we're going to cover the link between the no-pass zone and a patient-centered culture. We're going to talk about how it promotes quality, safety, and service. And we're going to share a case example from Patrick and his experience with the University of Cincinnati Westchester Hospital, along with the implementation tools that he used in that process. And then lastly, we're going to talk about the power of story in teaching service behaviors. Now that's something that we strongly believe in at the Baird Group. We talk a lot about the importance of storytelling. But before we get into the real meat of today's program, I'm going to be asking the audience two different polling questions. First question I have, and this is for the entire audience, is I would like to know how many of you have actually implemented a no-pass zone in your organization. So how many of you have implemented the no-pass zone? The poll is open now, so I would appreciate it if you would quickly give me your response so we know who's who in the room. All right, and it looks like the majority of you, 75%, have not implemented no-pass zone, and about 25% have implemented the no-pass zone. So with that, I have one more question, and that is, how effective has the no-pass zone been for those of you who have actually implemented it already? All right, it looks like just a few of you say it's been highly effective, 44% say it's somewhat effective, and none of you said highly ineffective, but some are saying, 22% are saying somewhat ineffective. So that gives me a good idea of where we are in terms of the the audience and what your situation is with the no-pass zone. So the majority have not implemented, and those who haven't really had the best of luck. They're not saying it was excellent, but they're not saying it was the worst ever either. So let's start right in with what is a no-pass zone? And the simple definition is that it's an organization-wide commitment by every employee in the organization to, answer any call light that pops up, any call light that they see. It's not just a policy, it's a way of life. So it's not just as, suddenly you're saying, we're going to do this no-pass zone. You have to make sure that you have your ducks in a row so that people feel confident and competent. So why implement a no-pass zone? Well, number one, because you want a culture that stands behind a promise of service excellence. And that, by implementing it, it sends a message that everybody in your organization is responsible for patients, regardless of their title or their job description. And it provides patients with a faster response time, which, this adds to safety and service as well. And it empowers all the staff to be a part of the care team. Many of your staff that are clinical, they really want to be a part of the solution, a part of the care team, but they don't feel empowered to do so. And so you're helping to empower them. And lastly, definitely not least, it supports your nursing staff. By having a no-pass zone, you're sending a clear message that we're all in this together. Everybody is here to serve the patient. And as I said before, there's a lot of people that want to be responsive, but they didn't feel empowered to do so. And nurses feel a sense of call light fatigue. They want to be responsive, but oftentimes they're pulled in a lot of directions. And they also feel like HCAPs fall squarely on their shoulders. That there's a lot of HCAPS questions that pertain specifically to the nurses, and they're feeling like, the entire patient satisfaction element falls on their shoulders. We also know that there's a strong correlation between responsiveness and overall satisfaction. So all of those are important reasons why you want to have a no-pass zone. And what I find in my consulting work is that most organizations that we work with tell me that they are incredibly, patient-centered, they're service-minded, and they really believe that they are. But having a no-pass zone really demonstrates it. So I want to hear from Patrick Baker at University of Cincinnati Westchester, because Patrick has done a great job and successfully implemented a no-pass zone. And so I'm going to turn it over to Patrick.
Okay, thank you, Chris. I think you did a nice job of setting the table for our discussion. I think really what I'd like to talk about to begin with is that there's over 5,600 hospitals across the United States. Every organization struggles with aligning behaviors and cascading information down to their employees. So it's really tough. If I walked into any hospital across America, I probably could talk to the senior leadership team or leadership team and ask them if aligning behaviors is a challenge. And it's a challenge in most hospitals. So when it comes to training staff in hospitals, at long-term care facilities and hospitals, it is a challenge. Finding the time, the resources, and the training and getting it to stick is really hard, and especially if you're trying to do cultural change. So really what we want to talk about, the key points here are obviously creating a culture of safety. It improves everybody's experience. Cultural change is facilitated by emotional connections, and then the storytelling is very important in that emotional buy-in. So next slide. So what I want to talk about real quick is just the significance of the cultural change in the staff's response and attitudes towards call lights. At our organization, and Chris mentioned this with the HCAPs, we have historically struggled with the responsiveness to call light times. And then on top of that challenge, and Chris mentioned this earlier about the alarm fatigue. We have so many alarms going off. A good example of that is bed alarms. You have bed alarms turned on, and people flip-flop around in the beds, and then next thing you know, somebody's turning off the bed alarm, and then the next thing you know, you've got a patient fall. So alarm fatigue is a serious problem in healthcare. So you take those two significant challenges, and in our organization, we start looking at, we participated in what we call the AHRQ Patient Safety Survey. And when we did that AHRQ Patient Safety Survey, we realized as an organization we have a huge opportunity to improve the perception of safety and teamwork. And so as we contemplated how do we want to address improving the perception of safety and teamwork, it drew us back to what we just talked about here. Was one of our major problems is responsiveness to call light times and alarm fatigue. So that was really our driver to thinking about maybe doing something. And if you continuing on with the alarm fatigue, as the slides are showing, it's overwhelming negative outcomes attributed to alarm fatigue. And what's interesting is the Joint Commission just created, obviously had a national patient safety goal addressing the alarm fatigues back in 2014. So as a hospital, we realized that we had an opportunity to address those two areas. Next slide. Okay, so alarm fatigue and patient call lights. So as we focused on the responsiveness of the staff, we realized we could address two things with this. We could address the patient safety and call lights with an initiative called the No Pass Zone. Okay, next slide. With the with patient safety, obviously patient safety being a top priority, obviously the Joint Commission it created its first patient safety officer in February of 2016. So the Joint Commission is obviously telling us that it's a high priority with a goal of zero patient harm. Patient satisfaction scores are critical to how well how well patients are doing. We have HCAHPS, your reputation, and then the market. But one example, so when I talk about this, when we were thinking about the No Pass Zone, when I sat down with our leadership team, I said to myself, I said, okay, so how do we treat an emergency in the hospital? And I'll give you an example. So just kind of walk, if you go back real quick. I asked our staff to say, okay, so if you're in the gift shop, and I asked one of our housekeepers or lab workers, if you're in the gift shop and a patient and somebody collapses on the floor and passes out in front of you, what do you do in the gift shop if somebody passes out? Well, if somebody passes out in the gift shop, everybody would jump in, call 911, call your emergency numbers. People, my point is, people would respond. People respond because they see it. So then it got me thinking. I said, well, okay, so every day in our hospital, we have hundreds of patients, and every day we have call lights going off, and when that call light goes off, we don't know if it's an emergency or what the request is. So if somebody would respond, if a housekeeper or maintenance worker or somebody from medical records would help somebody in the gift shop because they saw it, an emergency, then why do we have people walking past call lights going off in our hallway, in the hallways, up and down the hallways? So we said, well, why don't we, and that was kind of the genesis for the No Pass Zone. We said, okay, so next slide. So we said, so the No Pass Zone was born, and we said, okay, how do we do this and create real change? We've got over 1,000 employees here in the hospital, and what we said is we want to engage 1,000 employees to help us with patient safety. And so when we designed the No Pass Zone, we said that we wanted to create, we had a term we called it, we said we want to create 1,000 patient safety ambassadors. So just think about that for a second. You've got 1,000 employees in your hospital, and just think if you just created a culture where you just anointed 1,000 patient safety ambassadors. So if a call light is going off, you don't know if it's going off because it's a medical emergency. You don't know if it's going off because they want some more ice water or they want help getting out of the bed, go to the bathroom. You don't know if they're aspirating and they're calling for help. We don't know why the call light's going off. So we said, okay, how neat would it be if we had 1,000 people all engaged with the focal point of patient safety? And so when we talked about this and contemplated it, we said, okay, well, we've got to design a program where we want people to all be engaged in this, but we need it to be realistic with what we were expecting. And what I mean by that is I can't expect a maintenance worker to go in and service all the requests. I can't expect a pharmacist or a lab tech to go in and service the call light request. So our goal when we design the No Pass Zone was to say, okay, if you see a call light, you don't pass the room. You stop in, you introduce yourself, and you simply say, hi, my name is Steve. I'm from maintenance. I saw your call light. I just want to make sure you're safe. And that's the goal. And so that's the overriding message we asked our staff to do, is just to go in, introduce yourself, make sure they're safe, and make sure that there's not an emergency. But with that, when we thought about with the HCAPs and stuff, what you're doing is you're acknowledging the request. And if you look at the literature clearly tells you about waits and delays, that as long as the patient or the customer knows how long they're going to be waiting, or they've been acknowledged, then that alleviates their anxiety with their wait times. So if I'm waiting and I don't know how long I'm going to be waiting, my anxiety goes up. So by having the call light go off and having the closest person, that's the first person to see it, go into the room, you're acknowledging that call, and that immediately feels like they've been heard, and then if that makes sense. But so getting into the cultural change aspect of it, we did not want to design something that was a gimmick, that directives from the top down and memos. We wanted true change, and a change that requires a commitment to help us with that. And we wanted to motivate our employees by emotional connection. We wanted that emotional connection with our employees. And the way I describe the emotional connection is a lot of hospitals and leaders have good intentions, and they try to initiate some change, but they don't do a good job of explaining the why. So you have an initiative, but why is that initiative so important? So we wanted to go out of our way to really explain why this is important, why it matters, why patient safety is everybody's job, and again, go back to making everybody patient safety ambassadors. So we needed to manage expectations, and how we managed expectations was, again, to go back to and say, we're not asking the lab technician, we're not asking the medical records person or the x-ray person, we're not asking them to go service the request. We were managing expectations by simply saying, all we want you to do is to go into the room, acknowledge the call light, make sure they're safe, and then make sure that then call for the nurse and let them know that you're in the room and what is needed. So that managing expectations really was a key piece, because it goes to the next point about dealing with fears. So and we found this out with our training sessions. The non-clinicians have a lot of fear with going into patient rooms. And a good example of that when we did our training sessions is we had staff members tell us, Patrick, I feel like you're giving me permission to go into the rooms. And I thought that was very interesting and powerful. I said, so here we've got all these employees, and they walk up and down the hallways, and they see the call lights, but yet they felt like it was the nurses and the PCA's job to go into the rooms and answer the call lights. So they would just walk right past them. Now, after we implemented the no pass zone in our training, they feel like they've been given permission to go into the rooms. And that really helped eliminate some of those fears, but then it's also eliminating the fears when they say, okay, I don't have to get the patient up out of bed to get them to the bathroom. Because if they're not trained for that, we don't expect them to do that. But just going in and acknowledging it, making sure they're safe, everybody can do that. And what we had to tell our staff was that if you wear a badge, a name badge, that's your authority to go into a patient's room, because it's everybody's job to keep everybody safe. So those are some really big, focal, important talking points about when we implemented this and how it was effective with our strategies for implementation. Because, okay, so next slide. So the no pass zone in Westchester Hospital. So we wanted a more effective way to install the system-wide cultural change. We had to develop a collaborative co-production with Health Nuts Media. And then with that, we created the animated training series. So I want to go off and tell you a quick story here to say when we did this, we actually tried to do this on our own. So when we first had this idea about the no pass zone and making everybody a patient safety ambassador and improving call light times and patient safety, we had a nurse that went around and on a video camera went around and videotaped the leaders in the organization, and the leaders in the organization might say something like, "Hi, my name is Patrick Baker and I support the No Pass Zone." And then we did that probably with 25 different leaders across the organization. And so we started to watch this video, and we were just trying to do something creative on our own. And we were watching the tape of the videotape we made, and then our magnet coordinator, her name is Judy, she sees the video and she pulls me aside and she says, "Patrick, there's no way you're showing that video to your CEO." And I said, "Oh, okay." So it made me really pause and reflect, and I appreciated that candid feedback from her. And it really challenged me to say, okay, this isn't going to work. I wanted something that was going to just be that wow factor. That's something that, how do we create a video that within 3 or 4 minutes just captures the absolute essence and spirit of what we wanted to do with all of our employees? And so we contacted Health Nuts Media and Dr. Greg Alexander and Tim Jones there. And we kind of just thought out loud for a little bit and brainstormed and said, well, this is what we're thinking and this is what we want. And I think Tim and Greg did a great job of listening to our plight and what we were thinking about doing. And so that was kind of the genesis for the No Pass Zone. So as we began the program development, it included obviously the conceptual outline. We needed to create the concepts tied to the staff training requirements. We had to go through the storyboards and incorporate the necessary elements into the engaging narrative. The vocal recording, obviously, Tim and Greg do a great job with the professional voice actors for the script. The animation, the multiple training sessions we created, and then we included some ancillary training material. This slide says a lot of information, but I want to go back, if you could go back real quick, Chris, to that slide. It took us, just to put it into perspective, into context, it took us probably almost 4, maybe 5 months to do this video. And what I mean by that is we were very purposeful and thoughtful about every single word that was in that script. And plus there was being on the healthcare side, there was a learning curve with working with a company like Health Nuts Media, because I might have it in my head in a vision of what I want to see, but the Health Nuts Media is trying to make that come to life. And so they would present the script to us, we would read the script, we would edit the script, we'd kick it back to them, they would kick it back to us, and that process really took a lot of time. And I have to give Tim and his team a lot of credit, and Al, because what they did is they gave it back to us. We viewed it as a team, and as a team we made edits and changes. And what I learned is that when you're dealing with a professional company like the Health Nuts Media, I don't realize the complexity with changing a scene or changing a voice override with the voice actors and different things. So we really learned that that process. And I just want to say that it took us a long time to do it, but what I'm really proud about is in that 3 or 4 minute video, it absolutely nails the spirit of everything we're trying to do with the No Pass Zone, and do it in a way that, and Tim and Al and Greg really brought our hospital to life. And when we go through some of the screenshots, you'll see some of that, and I can point that out. But the Carl, who's the police officer, public safety officer in the video, we purposely picked him because he's a non-clinician. He walks up and down the hallways, and in the past he would just walk right past call lights. And so it was funny, we took a picture of one of our employees, and that's Carl in that video. Just the little details to the call light, the sign, the signal of the call light is exactly a replica of what we have here. So I just want to say that it personalized the video for Westchester and UC Health, the way they were able to do it. But just wanted to talk about that. Okay, next slide. I'm going to kind of walk through we can't show the video here on this webinar, but I'm going to just go through some still images. And really what we're trying to capture here is this is the hospital entrance, and we're trying to show that busyness. Everybody's coming and going. Everybody's got a job to do. And again, you're seeing the quick pace of everybody up and down, walking down those hallways. And in the past, all these people were walking right past those call lights. So here's Carl. Carl is going to make his rounds, and he's doing his duty. And Carl sees the call light going off, and he's been trained on the no pass zone, and he's got a decision to make. And what the guys did, and Al and Greg and Tim and them did a great job, is they gave like a little scenario here. So he sees both call lights going, and he's got a decision to make. Does he answer the call light or does he not? And so Carl decides not to answer the call light, and he walks down the hall and he ignores the call light. And so then you hear all this commotion and all the noise and everybody running in the room, and obviously there's something that happened in that room, and there was an injury and a lot of panic and hectic activity going on in that room. And so Carl flashes back, and it's almost like he gets deja vu, and he gets to relive the moment, and he feels guilty that he missed it. So now he flashes back, and he sees that call light, and he says, you know what, it's the right thing to do for patient safety. I'm going to go answer this call light. He goes into the room. He sees the patient reaching for the wheelchair to get up out of bed and struggling. And Carl's there to save the day, and he introduces himself, and he says, hi, I'm Carl from Public Safety. Saw your call light on, and I just wanted to make sure you were safe. Is there anything I can do for you? And he assists her to prevent a fall. Carl reassures the patient. He calls the nurse and says, hi, this is Carl in room 205. I'm here with Mrs. Smith. Can you please come in and help us? And the nurse comes in and does what she needs to do to help the patient get up, go to the bathroom, or whatever that was needed to be done. So that was kind of really quick, but if you get a chance, and I know you can contact Chris after the webinar, but I think that video is certainly worth viewing. And what they can do is they can help you work with your organization if you want to customize and personalize that video, if you would like to go ahead and do this down the road. Next slide. Okay, what's important here, and again, going back, as we thought about this, that video that we just went over, I thought was really well done. But there was a missing piece here. So when we decided to do training, we were going to train, we decided to do training for over 1,000 employees. And we said, okay, so we're going to have 1,000 employees get trained on the no pass zone. We got to show more than just this video. The video is great. But so what our team decided was, we said, okay, what are some of the scenarios that the staff are going to walk into? So when you kick off something as important as the no pass zone, patient safety, HCAP's responsiveness to call lights, helping to create this wonderful culture in your organization, we said, okay, so a couple of things are going to happen. There's going to be people that blow past the call lights. And as you can see here, Carl sees this is actually a dietitian, registered dietitian, walking right past that call light. And in the training video, you can see that she sees the call light, looks up at it, and ignores it and keeps walking. And so what Carl has to do, and we pause the training at this point, and we say, Carl has a decision to make. And what we told the folks attending the training class was, this is going to happen to you. You're going to see employees that aren't compliant with the no pass zone. And we were really trying to plant the seed to say, what are you going to do to make a difference to help us hardwire the no pass zone? So we talked through that session. We said, okay, and we did roundtable talks with the attendees. And it was overwhelming that people do not like to confront people. How do I tell my fellow employee, oh, hey, you didn't stop at that call light? And people were really, I got a variety of different answers. People were honest. Some people said, well, I wouldn't say anything. I would just go in the room myself. Some people said, well, I would go tell their supervisor, or I'll go do this. And so the point of it was, we said, okay, well, what would Carl do? And so what we said was, Carl, instead of trying to be non-confrontational, simply points out the call light going off, and he offers to go answer the call light with her. And he says, why don't you come in with me and we'll answer it together? And we thought that was a nice Pollyanna best practice kind of way to handle that scenario, is to demonstrate and make somebody feel comfortable going in there. So Carl and her go in, they answer the call light, and it was a good outcome. But the key point that I'm trying to emphasize here is that we had to have that discussion with the staff, because it's hard to, what we call around here, we want to enculturate the no pass zone, make it part of our culture, make it part of our practice. And something can't become part of your practice if your employees don't help us hold each other accountable. If everybody's just going to blow past the call lights, you really don't have a no pass zone as your practice in your organization. So we wanted to address that training, number one, and we really had a lot of good discussion with that. The other scenario we thought about was, you're going to have situations where employees are going to walk into a room, and guess what? The patient's not happy. And it's anything that you did. It's nothing anybody else did. You just happen to be walking in, see the call light, and that patient is not happy. And so we wanted to have that conversation with the staff. And so we pause the video. We show half the video, pause it, and we have a conversation. We said, okay, how would you handle that scenario? How would you handle the situation if you're getting this? And so we had to talk through that conversation with the employees and tell them that A, it's going to happen, and B, what to expect, and give them some training on just that authentic listening, holding somebody's hand, just being there, and just knowing that they're not yelling at you, you did nothing wrong, and just that again, that authentic listening can make all the difference in the world. Calling their nurse and just trying to be a calming factor for that patient at that moment. So it was really informative to kind of go through that training session with all the staff. Okay, the next one is the employee. So we said, okay, we wanted to have another training scenario. What's going to happen when we roll this out? In this scenario, the video portrays, you've got an employee who is going to answer the call light because he's being told to, not because he wants to or he believes in it. So he goes in and he's rolling his eyes and says, "Hi, I'm Steve," or whoever, and I saw your call light on. And his nonverbals and verbals are seen a mile away, and they can be it's telling the patient, I don't want to be here, but I'm doing it because I'm going to get in trouble if I don't. And so we wanted to talk about that. And what was interesting is I said, do you think that this is going to happen? And everybody in the training sessions, yeah, that's going to happen. And we said, okay, why is this a bad thing? What are you saying about yourself and the organization? And then what we said, when we showed this video, we pause it, and then we get some Q&A with the staff. One of the nurses in the crowd raises her hand, and she looks at everybody in the training session. And this is a true story. And she looks around and she says, "Don't even think about going into one of my patients' rooms and acting like that." And I was a little speechless. I said, "Whoa, what, you know?" And the nurse said, she says, "Listen, I've got to be with that patient for 12 hours, a 12-hour shift. I got to be with that patient." And she says, "You're not helping me if you go into somebody's room and have an attitude, and all you're doing is making my day harder and the patient's day harder." And she goes, "So if you're going to go into a room and act like that, don't even bother going in." And I was just so taken back. Like, I was just like, wow, here's a frontline staff nurse that is saying, it was just powerful to have her say that to her colleagues and staff members. And it was just a really powerful moment in that training session. What we do is really emphasize the difference between going into the room with an attitude, a poor attitude, versus going in with the right attitude. And that we also talk about, with our patient satisfaction scores and stuff, we give an example. The average patient with a length of stay of 3 days will have almost 36 different people walk in their room to take care of them or do something with them, whether it's an x-ray, lab draw, housekeeping, different nurses, different doctors, 36 different people in that room. All it takes is one person going in with a bad attitude to leave a negative perception of that patient, or of us, the staff and the employees, for that patient. So one person can blow it for the rest of the team. So we just try to emphasize that every interaction and encounter with the patients matter, and how you come across matters and can make a difference. So so when we rolled this out, again, we had multidisciplinary groups of 20 associates and volunteers at a time. We conducted 45-minute interactive training sessions. And so let me just pause there with our current staff. We had, again, we had over 1,000 employees we were training. I can't tell you, I can count probably on one hand how many times we've stopped the line and did mandatory training on 1,000 employees. We just felt it was that important that we didn't want to cascade this to the managers and the managers then train their staff, or we didn't want to send it out versus Right Knowledge where you just do some web-based training thing. This was so important to us that we trained 1,000 employees for a 45-minute interactive training session. And we did that by, we trained 8 leaders within the organization to be a facilitator, and then those 8 facilitators conducted the small group sessions of the 20 associates. And we purposely picked 20 associates because we wanted to keep it small and we wanted it to be interactive. We wanted the Q&As back and forth. So, and we got tremendous feedback from the staff about the training sessions and how well they were, and the interaction with the multiple disciplinaries with not just nurses but everybody. So I just want to emphasize that we don't do that very often, and we did it because we wanted to drive home a point about patient safety, making them all patient safety ambassadors, and that everybody's job is to answer those call lights to make patients are safe. So I just want to underscore that. With the new employees, then we had to onboard, we had to incorporate the in-person training program with our new hire orientation. So as we onboard new hire orientation, we capture all of our new people coming into the organization so they understand the importance of the no pass zone. So within a few months, we had 100% compliance achieved. And just to take it a step further, to keep emphasizing the no pass zone, we've actually got on our name badge, we're getting ready to roll out a new program to keep it on the top of the mind with everybody. On the back of their badges, we're going to have them sign in, so when they've hit 5 call lights, they're going to be able to get a free lunch down in the cafeteria, throw their name in a hat to win a prize. But we want to make sure that we're doing it. So I just wanted to emphasize that even after we did the training, we're still trying to find creative ways to keep it on the forefront so it doesn't get lost and it's really ingrained in part of our practice. So the next slide, just kind of the last couple of slides I have is just to talk about the staff response. They said this training gives us the permission to go into patients' room, and I kind of talked about that a little bit. That was a powerful quote from some of our staff. I was never sure if it was okay to enter the patient's room. Now I know it's okay, and I just loved hearing those responses. The training has made me less nervous to go into patient's room. What a win. That's great. And then I will respond to call lights now that I know how important they can be. Just wonderful responses from our staff. A few more. It says, I now have a better perspective on the apprehension of non-clinical staff of answering call lights. That's important because now the clinical staff, and I think Chris mentioned this earlier, call lights historically have been under the burden of the nursing staff, and it's all on the nursing staff. The nursing staff's response to this initiative was like, wow, I've got a whole army of people that are going to help us. And to hear somebody go into a room, call the nurse and say, "Hi, Nurse Tracy, I'm in room 503. Mrs. Smith needs to get up to the bathroom." "Okay, thanks." It really builds the rapport and multidisciplinary teamwork between the units. It's just been a great thing. The last quote here is, "The frontline staff on every level have grasped the concepts of the no-pass zone from these short videos. There isn't one person who I've shown these videos to that they're wonderful and that they feel comfortable going in to to do the job with the no-pass zone." Okay, so I'm wrapping up my time. At this point, I go to the next slide. And I'd like to introduce Mr. Tim Jones, who is the CEO of Health Nuts Media, to go over the next couple slides.
Great, thanks, Patrick. And one of the things that we like to talk about is that power of story, and why do we, why do we approach our, our training in the way that we do? And at the end of the day, we really believe that the human brain is a story processor, not a logic processor. And in helping contextualize and tell these stories, we help to contextualize knowledge, provide some emotional impact, and create an ongoing narrative with what's going on. And for those, I don't know if everybody on the webinar today has had a chance to look at it, but Robert Wood Johnson and Foundation and Business Innovation Factory released last year something called the Narrative Playbook, the strategic use of story to improve care, healing, and health. And I think it just goes through and does a pretty good job of supporting a lot of the things that that we talk about and why we use story and storytelling in our approach. So the other thing is, why animation? And so a lot of times you say, well, we can still tell a story, but why couldn't we shoot a video? Wouldn't that be faster or cheaper? And I think Patrick hit a little bit on that. Some of that do-it-yourself, may or may not be effective. But we also talk about versatility. So if things change down the line, if we want new messages, if we have a logo, on the lab coats, if certain things change, how can we change those over time? Shelf life. If we shot a video, in 2011, already that may be looking dated. Hairstyles change, clothing styles change, the kinds of phones that people hold. Everything may look dated. That doesn't work the same in animation. So you have a much longer shelf life. With that, building value in doing this and being able to change over time. Acceptability is one of the things we look at a lot. So we've done a lot of research and seen that people bring biases to any encounter, but for whatever reason, when they're confronted with a cartoon character, they don't always have the same biases to believe or not to believe, to trust or not to trust, as they might with video. We can scale that, and obviously your animated character isn't going to go out and involve himself or herself in a scandal that could negatively impact on the organization. So those are some of the reasons why why we think animation is a great way to approach that. And then very quickly, a brief history. So this is really nothing new. Animation has been used for many years. Lots of different organizations. Smokey the Bear is one of the most sort of classic examples. Created in 1944 and still in use today. So a lot of what we've been talking about has that long shelf life, is able to reach people through lots of different cultures and socioeconomic backgrounds and languages and lots of different things, and has been used by a lot of organizations over time. And and then a lot of the same things that Patrick had talked about, and why we used animation for staff training. So it's engaging, entertaining, memorable, eye-catching, lots of that stuff. So I will stop there and allow, hand this back over to Chris Baird to facilitate a quick Q&A to wrap up our hour. So.
Yeah, thanks, Tim. And Patrick, thank you so much, too. I think this has been a great discussion, and it's been fabulous to hear about, why the story, why animation, and the success that you've had, Patrick, in launching this in your organization. So one of the key take-homes is that, what Patrick said is a culture of safety really improves everybody's experience. And I love the fact that you guys took a strong cultural, stance on this and said that, we're going to make this change. Safety is everybody's responsibility. And you did it through making that emotional connection and the storytelling to really engage and build buy-in with folks. So, thanks so much for sharing that example. I want to remind everybody that following this presentation, I'm going to be sending out an email to each and every one of you that are going to give you links so that you can directly view the video examples. I know that Patrick did a great job explaining the videos, but this will give you an opportunity to actually view the videos. For some reason, when we're doing these webinars, the video doesn't work very well. So this will give you an opportunity to stream those directly. That link will also give you some contact information for Health Nuts Media if you should want any more information going forward. So at this point, I'm going to request that you put in your questions. I know that some of you have been adding questions as we've gone along. And I want to make sure that we get a chance to answer all of them. So I see that we have a couple that have been posted. So the first question is, and I think this one would be good for Patrick. What was the response from your C-suite? Did they support you?
Yeah, Chris, that's a great question. So really, what I'd like to say with that is that when we did the AHRQ patient safety survey, that got the attention of the C-suite. So we actually scored pretty darn good on the AHRQ patient safety survey, but we wanted to do better. Like I said, there's 5,600 hospitals across the United States, and every day there's injuries. Somebody who falls and fractures a hip. There's surgical site infections. There's C. diff. There's hospital-acquired conditions. You name it. Hospitals are really not a safe place. And so I really appreciate the where healthcare is going to make this a move for for patient safety. So when the goal was to start the no pass zone, and I pitched it to our C-suite and my boss and the CEO, he loved it. He absolutely loved it, and I needed their support to do that 100% training for 1,000 employees. And not just do some web-based, go watch a video and click that you've watched it. We do so much training on the web and through Right Knowledge and different technology. This, we wanted, to your point, Chris, we wanted that emotional connection. We're taking care of human beings who are vulnerable, scared, and emotional themselves, and we want to push that compassion and empathy piece. And if they are hitting their call lights, the least we could do was acknowledge it as soon as we can and make sure they're safe. So that I really got tremendous support from my C-suite when we were able to articulate it and explain it in that manner.
And Patrick, this is another question for you. It says, you may have said this, however, I joined late. Is the person who answers the light required to stay with that patient until someone can come and help?
Yeah, that is a great question. And so we had to learn, we learned from this. So what we say is that we encourage them to stay till the nurse or the PCA can get in the room. But if it's a non-medical emergency, let's say they just want a warm blanket or something else, well, they can. What I tell people is, and this is a good way for the audience, I said, all I expect you to do is walk in the room, acknowledge yourself, and make sure they're safe. And that's what we strive for. If you can go get the coffee, or you can get the ice, or you can go get the warm blanket, by all means, go do it. But I don't say you have to do that. So we encourage them to stay in the room till the nurse gets there, but we don't require it. We ask them to use their judgment and just to make sure the patient's safe.
Thank you. And here's another one for you, Patrick. What were your responsiveness HCAP scores before, and what are they now?
That's another good question. So our HCAP, we're seeing an increase in our responsiveness to call light, responsiveness from the staff. But with HCAPs and patient satisfaction, press gaming, as everybody knows, you're usually about, we don't pull our data for about 6 to 8 weeks because you got to wait for the surveys to come in. So we've only been doing this now for maybe less than 6 months. So we're still gathering that data, but the early indications are that we see a correlation with improvement in our scores. But and to be honest with you, I think the biggest benefit we've had is just the having all 1,000 employees feel like they are now patient safety ambassadors. I can't emphasize that enough. It just took it off. It just took us to another level with how we're perceiving ourselves and our jobs and our roles.
And I really love that, Patrick, because I will tell you, in my consulting work, I see this so often where people talk about being patient-centered and, you know, a culture of safety, and yet, you know, it's like the old commercial, where's the beef? You know, where's the proof that they're really behind this 100%? And that's what I love about your story, is that you guys made it a commitment in the C-suite and said, you know, we are going to create 1,000 ambassadors. And you really put some teeth into it, which gets a lot of traction. So congratulations on that. Shifting gears here, another question that came in, I think this is probably best for you, Tim, and that is, I see the clips of the pictures of your hospital. Can the video be customized?
Yes, absolutely, and that's a great question, and that's one of the things we really pride ourselves on, and why we talk about sort of the approach that we take. So we've got really, you know, sort of complete control. So not only, you know, the exterior of the hospital, the interior, as Patrick said, you know, the call lights in those, you know, in the hallways are very specific to the kinds of call lights that, you know, the Westchester uses, the uniforms, and, you know, lots of things. And then as we think about broadening, going to other languages, other, you know, other kinds of things, we really have that that ability, especially with animation, to control each and every aspect, you know, of the video. So so we've got very granular control about sort of every, you know, every aspect in the video.
Well, thank you all for being on with us. It was a pleasure being able to share this exciting video with you and a story of how it was successfully implemented. So with that, I'll sign off and remind you to keep raising the bar on service excellence. Thanks, everybody.
Okay. Thank you.
Thanks.